SingHealth is the largest healthcare cluster in Singapore. And when you look at A-Star has 4,500 scientists and engineers spread across 18 research disciplines. If you are able to put the two together in a very focused, integrated fashion, we will be able to address major challenges, solve problems that face the doctor today.
The prevalence of diabetes among Singapore adults aged 18 to 69 is 11.3%. And it is estimated that around 400,000 Singapore residents had diabetes in the year 2014. This may potentially go up to 1 million by the year 2050. So there is an urgent need to prevent the development of diabetes in Singapore, as well as to improve the treatment for existing patients. I think the most pressing challenge at the moment is the large number of patients developing diabetic complications, such as end-stage kidney failure, lower limb amputations, as well as blindness. We do hope that this collaboration through the use of technology and data analytics can help us to identify this complication at a very early stage for intervention, as well as to make better risk prediction at the population level.
So precision medicine refers to the practice of using data, be it a gene sequence, be it a lifestyle factor or an environmental factor, and integrating that data in a way that we can deliver more precise treatments and diagnoses for patients or people that are at risk for disease.
So one thing we're particularly interested in is understanding the genetic underpinnings of cardiovascular disease in Singapore. And what we don't fully understand is what's normal in Singapore for DNA and what's abnormal in Singapore for DNA. And so we're very interested in looking at these factors, and we have access to the clinical material and the patients. But what A-Star brings to the party is a marriage of computational expertise, which can really help us attack the questions more fruitfully.
Drug development is one of the more direct ways for us to impact on health outcomes. This collaboration does provide the opportunity for researchers from both institutes to see end-to-end of the research spectrum and begin to understand the complementary capabilities that exist in both of these institutes.
So in short, the opportunity specifically for this project, which is having one single platform to address patients' concerns, and by doing this we can develop new therapies, we can optimize existing therapies, and we can so have tangible outcomes for patients and for society.
When you have collaboration, there are a number of different things that have to be there. The first is to have very strong partners. And you also need a really big problem that these two partners can attack. So in this situation, it seemed absolutely logical that a leading clinical institution like SingHealth would partner with a great research institution like A-Star. In SingHealth, we have a lot of leading clinical expertise. We have access to patient cohorts. We also have people here at Duke and US that have very strengths in the disease biology. And at the same time at A-Star, you have a lot of expertise in a variety of different platforms that one could bring to bear on these problems. I think that this sort of combination is really required to tackle these really big problems.